Okay, hi there, it's Dr. Buford. We're just getting started on the left shoulder. We've got a shaver coming in. And just for orientation, remember you're laying on your side, your arm's pointing up in the air in a shoulder holder. And this labrum in front of the biceps tendon is torn quite a bit. So you do have what we would call kind of a degenerative slap lesion. You can see how this is loose and can cause symptoms. So we're going to get a high-fi suture, and we'll pull the relay out of the, we'll need a spinal needle. We're going to do a biceps tenodesis here, at the very least. But before we do that, we're just going to clean up the labrum just like that. Okay, now we're going to have a look around the rest of the shoulder while they're getting those things ready. And as we look down the front and focus here, we can see the anterior shoulder looks pretty good. The cartilage is maybe a little bit thin on the humeral head up above, but not bad. And then as we pull back and look at the posterior shoulder, this is the posterior joint capsule. We can look at the insertion into the humeral head up above. And that all looks pretty good. You've clearly got some arthritic changes on the humeral head here that we can see. But the glenoid's in pretty good shape. Now, as we pull back, we're going to look up at the rotator cuff, get our first look here. And at least on the articular side, this looks pretty good, but we know that you've got kind of a bursal-sided tear. And so that's the tendon right there that we're most likely going to be repairing also, in addition to the biceps. So the next step is to take a spinal needle and to pass it through the biceps tendon. And in just a second, you'll see that come through. There's our first pass. And through that, we're going, here you go. Through that, we won't need that. Through that, we're going to pass a shuttle relay. I need a grasper. The arthroscopic, yep. Keep going. I got it. If you hold the scope, why don't you, 2 hands, hold it right there. Okay, and I'll feed that through like that. And now we'll take a free hi-fi suture and load this into the relay. Keep that right there. Okay, so here we are placing the spinal needle one more time through the biceps tendon. We've already passed a number 2 ultra braid suture, and now that, let me get that grasper again, thank you. Now we're going to pass the relay through one more time. Keep going. Hold the camera, please. Okay, and now the trick here is going to be to hold the camera still. And then we're going to hold the camera real still right there. Let me put you in one place and then just hold it still. And now we're going to reach over here and grab the relay. Okay, this is going to give us a real strong loop around the biceps tendon. You'll see how that works in a second here. Okay. Okay, and so now we'll take an arthroscopic pair of scissors. That gives us a real strong hold on the biceps tendon, as you see there. And now we'll take a pair of arthroscopic scissors. Pause. Okay, so we've got the biceps released. We're just going to take our shaver here and just smooth out the edges a little bit. Doesn't take much. And now that biceps won't be able to cause any pain inside the joint because it won't be pulling on this labrum anymore. You did not have any shoulder instability. I don't think we need to repair the labrum. I don't think it's going to be unstable. And that looks good. So now the next step for us is going to be to go ahead and look at the rotator cuff in the subacromial space and see if there's any bone spurs or anything else we can do to help out up above. So we'll go off on the video for a minute while we change positions with your shoulder. Okay, so we've got the tear identified, and now we're going to take a spinal needle and just plan our angle to place the suture anchor down. There's the tear. So if we place our anchor down, that's not a bad spot. We might be able to go a little bit steeper. Just to give you an idea, there's one of our sutures for the biceps. So the front of your shoulders to the left, the back of your shoulders to the right. And I think I like that position the best, right about there. I got it. Okay, so we've got our anchor in position. I just wanted to show you. It's got 3 sutures coming from it. We're going to reach in from the front now. And we'll take the first posterior suture. This black and white striped one's a good candidate. We'll take that right there. We'll show you some more in a little bit. Okay, so here's the edge of the tendon. We're going to reduce it like that. We've got a stitching device right here. And when we reduce it, we can use our stitcher. Pull 2 hands on that so it doesn't move, please. Okay, here you can see the suture hook. We're going to go ahead and feed the relay, and that's what we use to move the suture back and forth. Okay, we're all done here. As we rotate the shoulder, you'll see what we've done. We've got 3 sutures tied. That cuff is repaired back to the bone, and hopefully that'll all heal down and do well for you. We're going to finish up here shortly and get you back to the recovery room in just a few minutes, but this will be the end of the video, okay? Good luck to you now. Bye-bye.